just have them chime in then. All right. Well, thanks, Kristen Darcy, for joining us today. We know that there's been a lot of updates recently on COVID rules and regulations and legislation as it relates to leave and quarantining and isolating and the COBRA subsidy. So today we just wanted to cover what the latest and greatest are. And then, of course, we're happy to answer questions along the way. There's only a couple of you on this webinar today, so certainly, we can keep it more casual and you guys can ask questions as you have them. You can do that by unmuting yourself, or Darcy, it doesn't look like you have audio capabilities, so you actually should be able to send a message in the chat. And I'll send a message there now. In case you don't know where that is, I'll send this message and it'll pop up for you. And we can answer them that way. All right, let's get started. So my name is Emily Martin. I am the owner and founder of Ally HR Partners. We are a small business that offers HR support and services to other small businesses. So those that maybe don't have their own HR department, or they have an HR department of one who may not have, expertise in every area of HR. We come in as a supplement to existing talent and skill to inject an additional level of HR expertise into the business, from compliance to more strategic value add stuff like employee relations, performance management, recruiting, things like that. And then joining me today is Jeremy Higgins. Jeremy, I guess I can let you do your own introduction if you would like.
Yeah, sure. Thank you, Emily, very much. Jeremy Higgins, owner of Higgins Agency Group. We specialize in employee benefit strategies for companies of all sizes. Anything that's really tied into the employee benefits world: health, dental, vision, life, disability. We work hand in hand with Emily from a compliance point of view. There's so many overlapping pieces when you talk about disability, COVID paid leaves, those types of things. But we really specialize on service, advice, and knowledge and know-how. So, we want our clients to focus on, their business, and leave the benefits enrollment and benefits process strategies to us, and we become an extension of your team. So thank you very much, and happy to be here for this presentation.
And I can attest to Jeremy definitely being focused on service for his clients. Whenever I have clients that have questions or needs in the benefit realm that are not being met, I always send them on to Jeremy because I know he will take care of them the same way that I try to take care of them on the HR side. So if you are considering a change or need more support in that area, I definitely recommend reaching out to Jeremy. And then, of course, Jen Straight is here from Complete Payroll, who is helping put on this webinar. We'll be covering how some of their payroll systems might be able to help you with some of these requirements and regulations today as well. All right, so as I mentioned, we're going to talk about changes to leave requirements and options, aid and funding available. We'll go through briefly. I'm not an expert in the area, but we will definitely just hit on some major points of that, and then we can put you in the direction of more expert people afterward. And then Jeremy's going to cover specifically the COBRA subsidy requirements from the new emergency relief bill. A recording of this will be distributed after the presentation. So if you want to watch it again, you can, and we'll also include the slide deck as well. So you'll have, you can review the slides instead of watching the video if you'd like. And you're welcome to share it with anyone else who might be interested. All right, so what's new? Most of the changes have come as a result of changes to Department of Labor, Department of Health, but also federal and New York State governing body agencies. So this is an update on additional guidance and FAQs that might have come out, but also just laws that have been passed. So we're going to cover changes in all of those areas from all those agencies today. All right, so the first thing we're going to cover here is employee leaves. So the first type of leave that's out there, because there are many now, is the New York State COVID paid sick leave. So this is still required. This was passed way back a little over a year ago now, at the beginning of COVID. Basically, I'm not going to go through all the details because it is older and, the basics of this. So you should at least have the basics covered. But if you are an employer in New York State, chances are, with very few narrow exceptions, that you should be providing paid sick leave and or protected job leave for instances where employees need to quarantine or isolate due to COVID. So it's 5 days paid if you have under 99 employees, and 14 days if you have over 99 employees. And if you are at the 5 days, only 5 need to be paid. However, you still need to allow the employee to have off job protected for the rest of that time, with the option to use any accrued time off they have for that time for the rest of their quarantine or isolation period. So just to recap here, this is still required. There's updates on my website that covers this in more detail, but employees can take this up to 3 times depending on if they test positive or not for COVID. So keep that in mind. So potentially if someone had to quarantine or isolate because of exposure at first sometime last year, and now they get COVID, they could take this 5 or 14 days again. And then God forbid, COVID becomes a thing that people catch twice. They could take it even a 3rd time. So make sure you note that. So just some updates. CDC in New York State continue to update their guidance on what people need to do if they're exposed or have symptoms. On here, we cover what New York State's guidance is, which does vary a little bit from the CDC, but basically, if you're exposed to someone that has tested positive for COVID, employees must quarantine for 10 days no matter what. So even if they don't test positive, even if they never develop symptoms, if they've been exposed to a COVID positive person, they do still need to quarantine for 10 days. And of course, if they have symptoms during that time, they should get tested and all that stuff. Employees exposed who have tested positive for COVID-19 within the past 3 months and recovered do not need to quarantine or isolate or get tested again as long as they don't develop new symptoms. So there is that caveat now. If someone's tested positive and recovered within 3 months, they're considered to have enough immunity where their exposure would not require them to now quarantine again. And employees who have been in close contact with someone who's tested positive, and if they've been fully vaccinated, they also do not need to quarantine if they don't show any symptoms. So there are now those caveats for people who've had COVID and recovered or who've been vaccinated. Of course, if anyone tests positive, they still need to quarantine for a minimum of 10 days. Even if they were vaccinated or had it before, it's possible they could still get it. There's some breakthrough cases. So for positive tests, no matter what, symptoms or not, they still need to quarantine for at least 10 days, up to 14, depending on how long their symptoms last. You can always check out updates on this information and guidance on the CDC website, New York State website. Where the information differs, New York State's guidance is always superior, or I guess respected over the CDC guidance when it comes to being in New York State. So just keep that in mind, that there are some little differences between the two, and you should always go with New York State. So that's the latest updates with the New York State specific COVID paid sick leave. There is an additional New York State leave out there now for vaccinations specifically. So this was passed earlier this year, and then a couple weeks later, there was additional guidance provided because it left a lot of questions when initially passed. But basically, all employees are now eligible for up to 4 hours of paid leave to get vaccinated. So this is similar to the voting leave law that's out there and that's been out there. But if you have employees who, for some reason, maybe because of their work schedule, can only go get vaccinated when during work hours, you do need to give them that time off and give them that time off paid up to 4 hours to go get vaccinated. This covers both doses for those vaccinations that require 2. So this would be that would be a total of 8 hours in that case. It also covers potential future booster shots. We don't know what's going to happen with the vaccination and how many additional shots will be required, but the law does stay in effect till the end of 2022. So that says to me that, most likely New York State knows there's going to be additional shots needed. So what rights do you have to push back against employees who might want to abuse this? You can require proof of the vaccination in order for leave to be paid. So if someone says they're taking this time to go get vaccinated, you certainly can require them to bring proof of that before you put it through to payroll. Just make sure you're keeping confidentiality best practices in mind. That information shouldn't be shared with anybody else. It should be very minimal to prove that that's what they were doing. The law does not apply retroactively. So if someone got vaccinated prior to the law being passed, before March 12th, and they had to miss work and they used paid time off, that's just too bad. Unfortunately, it doesn't go back in time. And then paid leave may only be used for the employee's own vaccination. Um, so if they're taking like a child or a grandparent or someone to get, the vaccine, this does not cover that time. And the New York State leave also does not cover any side effects from the vaccination. So if someone is sick and misses work afterward, they would still need to use their accrued time off or their paid sick leave or something like that. And then employers may require some notice for when an employee plans to take this leave. So, and that includes like having a discussion with the employee about pushing back if they're going to do this during work time, because certainly if they don't work the full-time schedule, they should be able to arrange to get the vaccination on non-work time. And you're certainly within your rights to have that conversation with them and push back on those things. So another leave that's out there required by New York State, the list keeps growing, but you do have some rights here to push back. All right. The probably most important topic, or I guess most complicated topic that we're covering, at least on my end in this presentation, is the changes to the emergency paid sick leave and the emergency paid family leave that are out there. So these leaves, if you recall, these are passed around the same time as that original New York State COVID leave. These were originally part of that original CARES Act that was the first act federally that occurred that passed legislation that gave employees a lot of rights and leave and benefits for COVID. Um, so basically, if you recall, this was required. So all employers, basically, unless you had over 500 employees, were required to provide federally subsidized through a tax credit, 80 hours of emergency paid sick leave for employees last year in 2020. And then this also expanded FMLA to cover COVID leave reasons as well, which basically made FMLA paid at 2/3 pay if you took it for COVID related reasons, which were mainly to cover childcare for when schools were closed and people had to stay home to take care of their kids. Well, January 1st came of this year and this became voluntary. It was no longer required. And then April 1st, there was another change where they extended this even further through the end of September of this year. However, now they've also made a few other changes where basically, if you decide to keep allowing employees to take leave for COVID, quarantine, and isolation reasons under the FFCRA, including getting that tax credit to cover this time you pay out, you do need to reset the employee's hours to 80. So anyone who's taken this before needs to have their eligibility reset. So previously, once you took your 80 hours, that was all you got. And if you needed to quarantine or isolate again, you wouldn't necessarily have time available to you and the employer could not take the tax credit for any other leave time they gave. Now that's being reset as of April 1st. And also the reasons that employees can take this emergency paid sick leave have expanded to cover not only their own self-quarantine or isolation reasons due to exposure or testing positive, but also seeking and awaiting test results, and then self-vaccination, so getting the vaccine, and then also, I think this is the biggest deal, the sickness from the vaccine. So if someone has negative side effects from the vaccine, and they want to say that they're sick for 10 days, now they could qualify for this 10 days or 80 hours of the emergency paid sick leave and be paid for that time. So these are all things that you want to consider if you're considering whether or not you want to continue to go forward and offer employees paid time under the FFCRA leave and take that tax credit for COVID related reasons. Emergency paid family leave, that's also been expanded. Now people can take that for all of the emergency paid sick leave reasons, and that's at 2/3 pay for up to 12 weeks. So if someone uses that 80 hours again, and for some reason they get COVID or like still need to isolate or quarantine, in theory, they can still take emergency paid family leave again after that and get paid 2/3 paid for that time. It also still covers all the other things that it used to cover. So all things to consider here. And the next slide kind of covers that. So April 1st has come and gone. Maybe you've had employees that have needed to miss time because of COVID reasons since then, and you've still continued to have that, be recorded under the FFCRA code in your payroll system. If you've done that, then technically you've kind of opted in for the continued voluntary use of this leave. So, um, if you haven't had people do that, then you might want to consider some of these things before you go ahead and do that. Um, so the biggest thing in my opinion, is just weighing the costs and the benefits of the loss of staff through abuse and expanded eligibility versus getting that tax credit for the mandated times that you have to give leave anyway under New York State. So if someone is exposed or gets COVID or, has to go get vaccinated, right? We covered that, for most employers in New York, you are required to give some type of leave and some type of paid leave for that time. So if you have to give that anyway, it's required by New York State, which is not subsidized by a tax credit. You may, want to just say, hey, we're going to go ahead with the FFCRA, continued on voluntarily, so we can always make sure we're at least getting paid back through the federal tax credit for those leaves we have to give anyway. Of course, if you only have to give the 5 days paid under New York State, 10 days or 80 hours is obviously more than that. But again, you're going to get paid back for that through the federal tax credit. You are going to lose that employee though for those 10 days. So all things that you want to weigh and consider. Also, make sure that you are including your employer portion of the healthcare or medical insurance premium in your reimbursement for the tax credit. So the employer portion of that is covered when you get that federal tax credit. You must do this for all employees if you voluntarily do it. So you can't just decide like you're going to have all your salaried employees be allowed to take leave under the FFCRA and not your hourly. It has to be for all staff. So make sure you're not doing anything like that. And then make sure you're always documenting this thoroughly. So if you want this to be FFCRA, then make sure that it's recorded as FFCRA in your payroll system. If it shouldn't be, then make sure that that's not happening. I think a lot of payroll companies are oversimplifying this, and anytime an employer might report that an employee is taking COVID leave, they're automatically coding it as FFCRA, which means, employees could be getting more than 80 hours, which is going to be an issue if you ever get audited for the tax credit. But also you don't want it to like insinuate that you're voluntarily doing this and put you on the hook for all that leave time for employees when you don't want that. So I would say check with your payroll provider on that. If you don't want all of it to be FFCRA, make sure you have different codes for, one that's for New York State vaccine, one that's for New York State COVID leave, and then one that's for New York State paid sick leave, which is the other required new time that's out there. So just some good housekeeping tips there to remind everyone of. All right. So any questions on that, on the topic of leaves before we move forward? Teresa came in late, so, all right. So really quick, just covering some funding changes here. You probably know about this, but remember there's PPP out there. So obviously the first round of PPP was available about a year ago at this point. Remember that your payroll spending component must be 60%. It started at 75%, if you recall, a year ago, and now it's 60%. There is a certain period that you have to apply for forgiveness, although that seems to be changing. So make sure you're always checking with your bank on that, wherever you got the loan from. Remember that the forgiveness reduction is generally tied to you restoring your headcount numbers and your maybe reduced salaries, by the end of the required period. So make sure you're keeping a track of that and not inadvertently disqualifying yourself from forgiveness by not following those rules. And then if your PPP loan was under 150K, you do have reduced forgiveness requirements. It removes a lot of those requirements for headcount restoration and things. So the application for forgiveness is also a lot shorter. So make sure, if you had a smaller loan, that you don't necessarily need to be worried about those things. There were updates to the PPP program in the newest emergency COVID relief bill this month. There is a second round of funding that is available. So you can apply for the PPP, a second round of funding. The application deadline to do that is May 31st. So if you're interested, you definitely want to look into that and maybe talk to your CPA or bank about getting that application. Again, it's, potentially free money that you're getting from the government. So why not? Also, if you're a nonprofit, there was expanded eligibility for those companies. So those that might have not been able to be a part of the first round can be a part of the second round. There is a higher level of qualification that you must meet in order to be eligible for the second round of PPP. You must demonstrate that you had a 25% reduction in gross revenues year over year from I believe it was 2019. So understand that you will have to meet that, threshold of proof in order to apply for this round of PPP. And the biggest thing, I think, the biggest change is that this doesn't, they changed the rules to say that if you receive PPP, it doesn't necessarily mean that you cannot get the employee retention credit as well. So let's talk about what that means, because that's just more money that's out there for you as an employer, where you probably, when you in a year where you took probably a huge hit to your revenues. So the employee retention credit is a reduction in your federal taxes. So unlike the PPP, which is, money that you get outright, which is being administered by the SBA, the Small Business Association, this is another tax credit like the FFCRA, and it's equal to a certain amount of qualified wages for employees that you kept and retained on your payroll during the covered periods. So basically, it's rewarding employers for not laying people off during COVID, but for keeping them on staff. Um, an eligible employer for 2020. Employers could apply for this employee retention credit back to 2020. So even if you got the PPP back in 2020 and you never applied for the ERC, then you might want to go back and apply for it during those periods now that they've changed the rules. And that would be for quarter 2, 3, and 4, obviously the quarters that were affected by COVID. In order to qualify, you have to have fully or partially suspended your operations due to a government order, which was basically everyone, and then had your gross receipts had to be down at least 50% from the same quarter in 2019. Obviously, there's a lot of other nuance to this, but these are the big things. Again, I would talk to your CPA for additional details if you're interested in doing this. And then you can take this for 2021 as well. The rules are a little different. Again, your operation had to be affected due to COVID. And then your gross receipts had to be less than 80% of what they were in 2019. So that's a big, big difference from the initial 50%. This is supposed to, be basically available for the most, severely impacted employers. And then the credit is for 2020 up to 50% of the first $10,000 of qualified wages per employee. So that's like, $5,000 potentially for employee that you kept. So that's huge. And then for 2021, it's 70% of the first 10,000, so 7,000 per employee. So this is big money. Again, it's in a tax credit. It's not cash to you, but it's another helpful way for companies and employers to find money at a time where they probably were pretty severely hit by COVID. So yeah, let's take a break here. And I saw this blinking. Oh wow, Jeremy, look at you getting in on the, the leave questions. So the question was, do you need to give employees 4 hours paid for the vaccine? And the question is, yes, you do have to give 4 hours, but actually, if they only miss 1 hour, I don't think that you need to pay them for the 4 hours. I think that, if they're only missing an hour of work and it only requires them to miss an hour of work, then you should only have to pay them for that hour. So I would have to look into that a little bit further just to verify, but I do believe that that should be the case. So thanks for that question. Any other questions on either the leave stuff or the funding stuff that we've gone over so far? All right. So just continuing on the employer retention credit, what's new about it? We kind of just covered a recap, but the period coverage eligibility period for coverage is extended through December 31st of this year. So that's huge, right? If you can get that tax credit for all of those wages through this whole year, that would be significant help to your payroll costs. It's available for all 4 quarters of 2021. And then startups are available to get this now as well. And by startups, I just mean basically newer companies are now eligible, which they were not before. There is a caveat, even more so for really severely financially distressed employers. If your gross receipts are down 90% or more, you can have all wages, potentially available to receive a tax credit equal to them. So again, if you were severely impacted, you may want to look into that. And then you can use the PPP and the ERC together. So again, using one does not eliminate your eligibility for the other any longer, but you just want to make sure when you're calculating the eligible wages, either for the tax credit or what you're using to calculate what your PPP amount should be, that you aren't double dipping into what those are, because you certainly can't get, double funding for the same wages. So again, that would be something to work out with your accountant or your bank when you're crunching all these numbers. So that is that. Other funding updates, if you're a restaurant, remember the restaurant revitalization fund is out there. I think this is amazing for restaurants. Basically, as a result of this, a restaurant could be made completely whole between this and all the other stuff that's out there with COVID for any losses that they had from this entire year. So if you're a restaurant and you have not looked into that, definitely should do that. There is the shuttered operations program that's out there as well. They've added more funds to that. There's new idle funding that's out there. So those are additional grants for your business that you can use to pay for PPE and things like that related to COVID. And then just a reminder that if you are voluntarily offering the FFCRA COVID leave, so taking that federal tax credit to pay employees for the time off for COVID reasons, that you can't use the wages that you pay to employees through that for your ERC or your PPP wage eligibility reporting or application, because again, you're already getting a tax credit for those wages through the federal FFCRA tax credit program. So that is that. So any questions before Jeremy gets into COBRA? A lot of information. And again, we're going to be sharing this after. So. All right. Take it away, Jeremy.
Great, thank you, Emily. I did want to clarify, my apologies. It is up to 4 hours with the New York State for the vaccine shot. So it's up to 4 hours, not mandated 4 hours.
Not a freebie of 4 hours.
Not a freebie of 4, right. But nothing can prevent an employer from granting someone 4 hours of time off if they're wise to this, that they could take the shot, check out at 12 and be gone the rest of the day. But if they come in, clock out an hour later, 1 hour would be sufficient based on Chris's question that he asked. All right, so let's change gears over to COBRA changes. So with the American Recovery Act, it's created a new assistant eligible individual, or AEIs, as relates to COBRA. This certainly complicates the COBRA process for the next 6 months from April 1st to September 30th. Essentially what this subsidy allows for is for those that are on COBRA or eligible for COBRA, based on a certain type of termination reason, you as the employer are actually responsible for paying 100% of the COBRA premium, of which then you can turn around and submit dollar for dollar reimbursement through your Medicare insurance tax reduction on your 941s. So new COBRA notices have been created. They're on the Department of Labor website. This will then dictate which notice for which circumstances. But let's get into the triggers of who is eligible for the subsidies. So it's for those employees that involuntarily are terminated, as in you let the employee go, as long as that wasn't for gross misconduct. If it was for gross misconduct, they are not subsidy eligible. If an employee resigned, left work, quit on you, they are not subsidy eligible. So those are the trigger qualifying events for eligibility. For those, if we take that a step further, you also cannot be eligible for Medicare, and you also cannot be eligible for other health insurance. Are also knockouts for the subsidy, but that's a little bit harder for you as the employer or a third party administrator to police. So, what is going to take place, and what you're probably working with your insurance broker on, if it's applicable to you, is there's a notice that's got to be sent out to everybody who's recently was terminated, okay, to see if there's a chance that they didn't take Cobra because they couldn't afford Cobra, but they don't have access to other health insurance or Medicare. So there's a notice that has to be sent out to former employees that are still in their Cobra eligibility period where they could have Cobra, because this is creating a special election period for people to jump back on to the Cobra process. All right. And that would be effective for April 1st. All right, and it only lasts through September 30th. So regardless of when you jump into Cobra, this subsidy is only for the physical months of April through the end of September. All right. There'll be a different notice that needs to be sent to any new terminations that you have any employees that are terminated April 1st or after. And then there'll be a secondary attestation form that members are going to need to complete that to attest to their being eligible for the subsidy or not. So there's no retroactive. If I'm on Cobra, I don't have to pay 6 months of somebody's health insurance prior to that. Or if I have somebody who was terminated in 2019 and they're still on Cobra today, Cobra itself still lasts its 36 months. All right. And the subsidy is only going to be for this 6-month period. Next slide. Okay. So what action should be during step one, and this needs to be completed, by May 15th, is you need to determine who's eligible for Cobra and who's eligible for the Cobra subsidy. So you got to take a look back at previously termed employees. Again, just identifying those employees that have been terminated by the company for not gross misconduct. Okay? Any other termination reasons are fine as long as it was triggered by the employer to the employee. Once those persons have been identified, then you're going to need to send a new Cobra notice to those folks. All right. The IRS, Department of Labor, does have the new notices, so they did meet the deadline. They actually had the notices available as of April 9th on the website. Going forward, all right, step two is now any new hires, new terminations going forward. We need to make sure that we send them a proper notice. The new model election notices are much longer than they were before. It has all the language regarded to the subsidy itself. That'll work like normal Cobra. You have to send those out. All right. The employee has within 60 days to make their election to get subsidized. And then if they do elect, they have to return those forms back to you. And then they go back on your group invoice, of which you as the employer would be responsible for paying. Then you have to apply for that credit through a Medicare tax reduction. What's also going to happen that not everyone might be aware of is then by September 15th, another notice is going to have to be sent out to everyone currently on Cobra to let them know that their Cobra subsidy is going to be ending as it stands right now, September 30th. Okay. So a lot of moving parts. People handle Cobra differently depending on if you're using a third-party administrator. A lot of folks are on direct bill Cobra with their respective health insurance carrier. So I did want to mention that Independent Health and Univera will continue the process as is. They'll allow you to let them know if somebody is subsidy eligible or not. If they are subsidy eligible, they'll take them off of direct bill Cobra and move them back onto your group invoice. For those that are not subsidy eligible, they'll continue to run direct bill Cobra and bill your former employee directly. Blue Cross Blue Shield, unfortunately, has taken a different stance. Blue Cross Blue Shield has raised its hand and suspended and said, look, we don't want to deal with any of this. So they've suspended all direct bill billings for April 1st and through September 30th. So if you do have Blue Cross Blue Shield and you had somebody on direct bill Cobra, check your Blue Cross Blue Shield invoice, because if you haven't picked up on it, they put everybody back on your group invoice, whether they're subsidy eligible or not. So even if you have somebody that is not subsidy eligible, that person's still going to show up on your group invoice. And now communication needs to be sent to that former employee that they need to start forwarding payment to you directly each month for the next 6 months. So Blue Cross Blue Shield, unfortunately, has created some complications with this process and some other headaches for those that actually have anyone enrolled in Cobra. But hopefully you should be able to get that information from your broker, should be able to get that from your Cobra administrator. But should anyone have any questions or concerns, feel free to reach out to me and my team, and we'll be happy to point you in the right direction.
All right. Thanks, Jeremy. Thanks for that. So yeah, like we said, I mean, the takeaway there is really to make sure you reach out to your provider, broker, carrier directly, whoever it is, and make sure all that's being taken care of. So, certainly you can reach out with any questions after this presentation to Jeremy or myself on anything covered. There are resources listed here. So the SBA website's really good for any PPP questions, and the SBA website is just really good in general for small businesses. So I would check that out. There is a COVID library on my website, allyhrpartners.com, but also there are a lot of articles and resources there just on different COVID updates as they have occurred over time. The IRS is a good site for the employee retention credit. There's also information on the IRS site regarding the FFCRA tax credits and how that works and how those are applied. So I would explore that if you have questions there. The New York State Department of Labor site has FAQs on the paid leave required by New York State, whether vaccine or, for quarantine or isolation. The federal DOL site has it for FFCRA leave questions. And then, of course, on the CDC website and the New York State site, there is also information on, what you need to do if someone's exposed or has to isolate or quarantine. Again, help is available, whether through myself, human resource wise. If you have situations with employees who are exposed and things, I continually field calls helping employees work through those or employers work through those things. But certainly you can reach out to me with any needs you have on that front. And then Jeremy's email is here as well. If you have needs on a benefits front, again, whether it's on this topic, other benefit topics that are unrelated. So we will take questions now. I'm just reading them here. So what dates of termination are covered under the new Cobra law? Jeremy, so that goes to you. So if I don't know if you want to answer that, I saw you answer it in the chat, but probably helpful to say it on here too.
Yeah, it'll helpful to speak to it because it's a little bit more complex. So New York, in the state of New York, we have mini Cobra, so that goes 36 months. Federal Cobra is only 18 months, but in New York State, it's 36 months. So technically, anybody that is currently enrolled or started Cobra as of May 1st of 2018, okay, April 1st of 2021 would have been their last month of coverage. And technically, if they were eligible for the subsidy, as in they haven't had access to other coverage and they're not access to Medicare, then just the month of April would have been subsidized, which would have been their final month of 36 months. And then Cobra ends normally on May 1st. So realistically, anybody with a termination date of 5/1/2018 and current, this technically could apply to as far as the Cobra subsidy is concerned. Now, granted, most people would be knocked out of the subsidy over that period of 35 months because they've had other employment or have other employment today, of which they're eligible for their employer health insurance coverage, which would be a knockout from the Cobra subsidy. But that is the technical worst case scenario looking back period of time is 5/1/2018. As every month goes by, we cut that out by 1 month and 1 month as we get closer to the 9/30 date.
Thanks, Jeremy. Any other questions, Cobra wise, COVID leave wise, even, kind of COVID related, not specific to anything covered in this presentation? All right. Well, thanks everybody for joining. Like I said, we're going to send a recording of this after, as well as the slides that you saw today. And if you have questions from there, you can certainly reach out. Otherwise, enjoy the sunshine.
Great. Thank you all so much for your time.
All right. Bye-bye. Thanks, Jeremy.
Thanks, guys.